Check the patient ID. Ensure all equipment is ready for Ryle's tube feeding. Ryle's tube of appropriate size. Adhesive tape or securing device. Lubricating gel, water-soluble. Glass of water with a straw. pH test strips. Syringe, usually 20 to 50 milliliters. Stethoscope. Feeding substance. Using milk for demonstration. Glass bowl. pH color scale. Surgical gloves. Surgical mask. Wash your hands and wear personal protective equipment. Position the patient upright. Grab the lever and rotate it clockwise to reposition the patient. Measure the tube. Place the tube starting point at the tip of the nose. Now, grab the tube from the highlighted part and place it at the earlobe. In the end, grab the tube from the highlighted part and place it at the lower end of the sternum. Mark the measured length with tape or a marker. Lubricate the tube. Grab the lubricating gel and open the cap. Now, grab the tube and dip its distal end into the gel bottle to coat it with a water-soluble gel for easier insertion. Place the tube near one nostril. Insertion of the tube. Gently insert the tube upward from the highlighted area. Now that the tube has reached the back of the throat, encourage the patient to swallow. Offer sips of water if permitted. Advance the tube slowly and steadily during swallowing to prevent discomfort or misplacement. Great! The tube has reached the marking point. Verification of tube placement, auscultation method. Attach the syringe to the end of the tube. Place the stethoscope on the stomach, then inject 10 to 20 milliliters of air into the tube, using a syringe while listening for a whooshing sound. We heard the whooshing sound, which means the placement is correct. Verification of tube placement, aspirate stomach contents. Take out one strip and place it in the glass bowl. Gently aspirate the gastric contents. Now, remove the syringe and drop a few drops of gastric contents on the pH strip. The strip color shows a pH level of 4, which confirms correct gastric placement. Secure the tube to the patient's nose. Post-insertion care. Attach the syringe to the end of the tube. Pour milk into the syringe. For feeding, place the syringe above the nose level. Flush the tube with sterile water or saline regularly to prevent blockages. Removal of Ryle's tube. First, remove the securing tape. Gently remove the tube by pulling it downward from the highlighted area. Congratulations! You have successfully completed the Ryle's tube feeding module.